Happy Friday. I'm Dr. Lugo. I'm not driving, the car drives itself. I'm watching. But the reason I'm here today is because if you're over 40, maybe younger, but over 40, more important if you're over 50, and you haven't seen your eye doctor, go see your eye doctor. Find a good eye doctor. I personally would go to an ophthalmologist if I was you. And your insurance covers any diagnosis you have there that is medical, glaucoma, for example. So understand you don't have to have separate vision insurance, but it's worth the investment to get checked. They check the back of your eyes, all kinds of things, the pressure in your eyes. There's so many conditions that can occur as you get older. And sometimes you can find little hidden gems or things that will point towards diabetes, vascular disease, other things that are not showing up yet on your eye. Remember, the eye is a connection to the brain, is the closest thing to the brain that you have, is an extension of that. So the optic nerve comes straight from the nerve. So they can see in the back of the eye things that are happening that could be slowly showing signs of a problem. Not only that, your eyesight is sacred. In my mind, it is. And there's something called glaucoma, very quiet, and it can lead to blindness. It's not a disease of the elderly. Yes, it is more common, but it will start showing up early, and you can prevent it. There are solutions. There's more than one type of glaucoma. There's other conditions that will show up, especially after you're 50. There's a condition called PVD, Paul Victor David. That's the letters. It's a posterior vitreous detachment. The jelly substance inside your eye starts detaching, and then you can have some visual symptoms, but that's not the problem. In a minority of people, this can lead to a retinal detachment, which is an emergency. Now, there's not a lot you can do to prevent that because it goes along with the aging, but you can start seeing it and you can start experiencing some of the symptoms and understand it. It's like everything. Prevention is key. So I would not just limit my eye checking just to look at a board and say your eyesight is perfect or wearing, reading glasses. It's more important to look at the whole health. So don't forget that. I would go see your eye doctor and then follow the recommendations. Sometimes you have to see them every year, sometimes you don't. Let them tell you what to do. That's my advice. Have a great day.